Hi, I'm Dr. Jim Sears, and I'm here to talk to you about erectile dysfunction and how men have been dealing with it throughout history. A little history lesson here. It's no secret, erectile dysfunction, or ED, is a common problem that affects a lot of men. It's estimated that about half of all men between 40 and 70 will suffer from it to some extent. ED can occur for numerous different reasons, including age, blood flow limitations, anxiety, depression, obesity, and too much drinking. Today, it can be effectively combated with a variety of treatments. Now, ED is not a modern issue. Fact is, ED has been blamed on everything from witches' curses to Chinese philosophers believing that a man's yin and yang would rob him of sexual energy. Traditional Chinese medicine going back 4,500 years used a potion that was formulated to help the emperor bed his 1,200 concubines. Good luck to that guy. Now, acupuncture, sticking needles in the body to align energy streams, has also been seen as a way to treat erectile dysfunction. And it's still a very popular ED treatment in America and China. Ancient Egyptians believed that ED was the result of evil spells or natural disorders. Their remedies included mashing crocodile hearts and rubbing it on the penis. Some Egyptian treatments are making a comeback, such as blue lotus flowers, which were once consumed by soaking the flowers in wine. Egyptians are said to have used the lotus flower as an aphrodisiac and a possible ED cure. Its active ingredient, apomorphine, is actually a fairly effective remedy for ED. Ancient Greeks and Romans utilized erotic foodstuffs, such as chocolate and oysters. Aphrodisiac is a word derived from Aphrodite, the Greek goddess of love. Aristotle extracted an aphrodisiac from the dried bodies of beetles known as Spanish flies. We know now that while Spanish fly was used for centuries as an aphrodisiac, it's both toxic and actually not very good as a successful ED remedy. I know I would not want to eat a dried beetle. Ugh. More recently, penile implants were employed based on the fact that many animals have penile bones. Implanting bone or cartilage was abandoned since the grafts were quickly absorbed. Now, in the 1960s, there were much more effective synthetic implants, although they were hard and caused pain. Yet to this day, implants are an ED treatment still used, but they might involve surgical problems. Along came a Pentecostal minister who was in the tire repair business, and he conceived the first penis pump. It works by attaching a pump to a cylinder which goes over the penis to pump up an erection. This resulted in the first medically approved penis pump. Lots of men still use them today. Some pumps provide a man with the ability to maintain an erection for up to 30 minutes. Pretty good. Somewhat more recently, a French surgeon accidentally injected the drug papaverine into the open blood vessels of a patient's penis. Ouch! Not really sure how that mistake occurred, but it did cause an immediate erection. He didn't realize it at the time, but he created a revolutionary new approach to treating ED. In fact, that was the beginning of intracavernosal injection ED therapy. In 1983, a British scientist injected his own penis to prove how effective this ED treatment was. But just a couple decades ago, another happy accident occurred. In 1994, scientists were researching the chest pain drug sildenafil, and they discovered it also caused erections. And in 1998, the FDA approved Viagra as the way of treating impotence. Lo and behold, within 5 years of it being made widely available, erectile dysfunction diagnoses had increased by 250%. Thankfully, we men have been born into a time when treatments for ED and impotence have come a long way from blaming them on evil spirits or inserting bones into one's penis. These days, vasoactive medications, ones that affect the blood vessels, when properly formulated and applied, can induce a good erectile response reliably and consistently. In expert hands, this treatment works over 98% of the time regardless of age or medical condition. With that success rate, men have few reasons to stop having sex. And medical breakthroughs like electroshock-wave therapy may be the answer to long-term rejuvenations. I'll talk more about these latest treatments in upcoming episodes.